Welcome to Science with Soul. I'm Dr. Lottie Valentine and the host of this podcast. I'm a physician, evidential psychic medium, international keynote speaker, and author of Med School After Menopause, The Journey of My Soul, an inspirational story about transformation, healing, and spirituality, available online at Amazon as well as other online platforms worldwide. The inspiration for this podcast came from my own life experiences. As I have journeyed through life, it has taught me that we're part of a greater divine web of interconnectedness. I have walked the path of illness, healing, and transformation. After 2 near-death experiences, I became clairvoyant, clairaudient, and clairsentient, and was guided to attend medical school at the age of 54. We will be meeting with many different types of doctors, healers, as well as spiritual leaders, educators, and other inspiring souls in this podcast. It is my hope that you will gain information and create a path to healing your own life, physically, emotionally, and spiritually, and bridge the gap between science and soul. If you are a person who understands the interconnectedness of mind, body, and soul, and would like to take one of my courses or work with me to create a path of healing your own life, please visit divinespiritualessence.com or drlottie.com. Welcome to Dr. Lottie Science with Soul. Today, I'm honored to introduce Dr. Julia Greenspan. Dr. Greenspan uses a balance of conventional medicine, alternative medicine, and energy healing methods for what is needed for her patients. Dr. Greenspan's goal is to support patients with compassion and listening fully without judgment. Julia Greenspan has been a naturopathic doctor for 15 years and is the author of the book Rising Above Lyme Disease. Her focus on tick-borne disease stems from living in New England area, one of the most infested areas with infected ticks, and being a patient herself in remission from tick-borne illness. She also specializes in mold biotoxin illness and PANDAS PANS, as well as detoxification protocols for heavy metals, chemicals, and mycotoxins. When working with multi-systemic chronic illnesses, she commonly works with symptoms of hormone imbalance, autoimmune disease, fibromyalgia, post-traumatic stress disorders, chronic fatigue, mental focus, and digestive imbalances. She earned her doctorate from National University of Natural Medicine in 2006. She holds a Bachelor of Science degree in psychology from Portland State University in Portland, Oregon. Prior to medical school, she worked several years in social work with a focus in crisis management in areas of domestic violence, suicide prevention, and working with the homeless population in Portland, Oregon. She served 5 years on the Naturopathic Board of Examiners for the state of New Hampshire. She has been listed in the top doctors' readers poll within New Hampshire Magazine consecutive years in a row. She has been interviewed as an expert on tick-borne diseases in New England on television stations, NECN and WMUR, radio, podcasts, and in print media, Union Leader and the Cabinet. She has also been published in the Naturopathic Doctor News and Review, NDNR. She is a patient advocate, loves public speaking, a tick-borne disease survivor, and mother of 2. Dr. Greenspan, in addition to being a licensed naturopathic medical provider, has spent years traveling the world and training with several teachers to evolve an intuitive energy healing practice. This is something which has helped her personally and professionally, as well as being a value to patients who wish to look outside the box during their healing journey. Please visit the energy healing page at greenhousemedicine.com to learn more. So warm welcome to you, Dr. Greenspan. It's an honor to have you as a guest today.
Oh, thank you so much. I appreciate it.
So let's get into finding out all the different things you're working with. So my first question will take me to Lyme disease. And I know you work a lot with patients that have Lyme disease. Can you talk a little bit about the symptoms someone might experience if they have Lyme disease and how they might have contracted Lyme disease?
Yeah, so the symptoms can vary the gamut. Lyme disease is referred to as the great imitator because it can look like a lot of other different diseases and chronic illnesses, and also acute infections as well. But my patients typically will have issues going on in multiple areas of their body by the time they come to see me. They will have headaches, difficulty concentrating, trouble with vision and hearing, having cardiovascular issues like heart palpitations, chest pain, breathing issues, digestive issues, musculoskeletal, so joint pain, muscle pain, neurologic, so losing sensation in the fingers and toes, or having sensations of bugs crawling on their skin, or burning, all sorts of neuro symptoms that it also, again, can turn into trouble concentrating and changes in mood, and personality. And so, a lot of times I try to catch the infection when it first happens. We all ideally, here living in New England, I know that's not the only place that tick-borne disease is. It's across the country, but we kind of have it much more saturated in this part of the country. And, just going out to your mailbox, you can get bit by a tick. And so Lyme disease is transmitted by ticks. There are different types of ticks. Primarily the one that transmits it here is the deer tick. And, they're very difficult to see. They can be very small. They also can numb the skin when they bite. And so they can be very stealthy and transmit infection to somebody, and very easily without someone even knowing that they were bit. And we try to, it's a benefit, or it's a gift if you find the tick on you, not that you want to be bit by a tick, but if you can find it, because then you can treat it right away. But a lot of my patients don't know that they've ever been bit. And so it can be, they'll come and meet with me after a year or two or more of being very sick. And that takes more, it takes a lot more to get them back to feeling better. And ticks also carry multiple infections, not just Lyme. And so it's also trying to identify any other infections that somebody might be carrying that could be contributing to their ill health. And so it's a very complex chronic illness.
Yeah. And so if somebody is listening and think, wow, maybe I was, bit by a tick, maybe that's my problem. How would they go about getting a test? Is that a blood test or urine test? How does that work?
Blood is ideal. And, it's really about finding a Lyme literate practitioner. And I would really, suggest that somebody visit ilads.org. It's an organization that is a collection of doctors around the country and around the world that are trained in treating chronic Lyme and chronic tick-borne infections, and really trained to hone in on the complexity of it, and the process of healing and really recouping from that, and what it takes to do that. And it can take a long time to recover. And they do have a doctor's list there. And so depending on what state you live in, finding a doctor that's near you. Of course, now with COVID, you can do telehealth with doctors all over the country, and be able to find somebody and see somebody. I'd say one of the biggest problems is patients finding a doctor to see, or historically that's been an issue of finding a doctor who will listen and hear them and and test and treat, that is trained to do that. But if you find a Lyme literate doctor, typically it's blood work. There are different labs that will test tick-borne infection. You can go through the standard labs that would be covered by insurance. And then there are also labs that you pay out of pocket for that might have a little bit more of a sensitivity or test more strains for tick-borne infection, because, it's not just one strain of Lyme in the country. There's over 50 of them or more, at least that have been identified. And so, it's important that the test kind of cast out the widest net possible to look at, multiple strains in order to be able to fully say, yeah, something's here. You've been exposed to Lyme or tick-borne infections, or looks pretty clean. And then, also looking at other avenues of other things that might be going on, as far as an autoimmune disease or neurologic issue. But typically blood is the preferred method as far as like is testing.
Mm-hmm. And you also mentioned that they could have other co-infections going on at the same time. So can you just talk a little bit about what that is for people who are not aware?
Yes. So I'd say the main ones that are most commonly referred to are going to be Bartonella. And again, I'm just giving the not going into the multiple different strains, because again, each one of these has multiple strains that will have it'll be Bartonella henselae, Bartonella quintana, and there's Babesia, anaplasmosis or ehrlichiosis, Rocky Mountain spotted fever. There's also discussion, and it's known that parasites are passed around by ticks. Viruses are passed along by through ticks. Powassan is one of them that gets a lot of attention here in this area. And so it's and there's different forms of infections depending on what kind of tick bites you as well. And then here also dog ticks transmit something called Rocky Mountain spotted fever, which is thought to be more in the Midwest, but I see it quite often here in the New England area as well. And each one of them has their own personality, their own, a lot of times they can meld into, looking a lot alike, but over time and experience of interviewing patients and taking their story and listening to their symptom picture, it gets easier to identify, and start to categorize, oh, that looks more like it's a Bartonella, infection with Lyme, or a Babesia infection, with a Lyme co-infection, or, they kind of have their own way of manifesting in the body and symptoms that might come up for somebody, and be more like their main symptoms. So whereas Babesia is related to malaria, or malaria-like infection, it's actually a parasitic infection of the blood, and it can create a lot of headaches, vertigo, a lot of digestive issues, nausea, fever. So just picture someone with like malaria in the jungle, and fevered, sweating, and mentally, emotionally, a lot of anxiety, a lot of shortness of breath, like they just can't seem to hold oxygen as well because their blood is impacted, and blood is very important in regards to carrying our oxygen to and then our waste away from tissues. Bartonella is more neurologic, and you'll have a lot more electrical sensations or burning sensations. Typically, it also has kind of a deeper mental picture with it, with depression, anxiety, suicidality, more intrusive thoughts, kind of more of a deeper psychiatric, a lot of more deeper psychiatric issues with that. With individuals that have been infected with that and stick with it for a longer period of time, it can impact people in that way. And so they kind of have their own areas of the body where they might have more of an impact. And they also have different medications and different, herbs that would be more effective at treating one versus the other. And so, it's great when you can identify it on labs. It makes it a lot easier, especially for the patient, to see it on paper, and to feel more confident in that, because by the time someone comes to see me, they've seen, maybe 5 to 10 doctors or more. And it gets very overwhelming and hard to have someone, acknowledge that it could potentially be tick-borne infection, or to finally find that diagnosis. So when someone does have the lab test done, and more times than not, I have people cry because they find out that they're positive for tick-borne infection, because they finally have an answer for why they've got issues going on in multiple areas, because they've had to go see a gastroenterologist, a neurologist, an endocrinologist, a rheumatologist, and the list goes on. Because, that doctor will deal with that subset of symptoms. And then just trying to get an overall picture holistically of what's going on with them is hard, for someone to put all the pieces together and not just diagnose a neuro issue like Parkinson's, MS, ALS, or rheumatologic, rheumatoid arthritis, lupus. So it's a complex issue. It's very difficult by the time someone comes to see me, that they've been through a lot. Patients have been through a lot.
Yeah. Do you ever find, how reliable do you find that these tests are? Do you ever have patients where you feel like they have Lyme disease, but then the test comes back negative?
Yes. A lot of times that has to do with an immune deficiency. So you oftentimes want to check to make sure that certain immune cells are strong enough for that they're present enough in the body. Because when we're looking at a lot of the different tests that we're utilizing, look at something called IgG, IgM antibodies. These are IgM antibodies are the first responders. Think of it like the paramedics, or you call 911, they're the first ones on the scene. And they hold information about coming in contact with that infection. And then we look at that in the blood to go, yep, you've come in contact with that. And so if somebody doesn't have an adequate enough amount of, those antibodies, then their tests are not going to be as reliable. There's also a difference in gender. So women have a harder time getting a positive to be a clear positive, versus a man, because through our hormone cycling, our monthly hormone cycles, it can change our antibody levels, thus changing the test outcome. Versus men who are, kind of more stable from month to month. So those are all kind of variables that are important to take into consideration. Also, the infections themselves have life cycles. These are microbes with, consciousness in a living system. They're a living being within a living system, and they're going to have their own cycles, and they're going to be, especially Lyme, they're going to be more it's going to be more dormant at sometimes and then more active at sometimes. And as those times that it's more active, you're going to see the antibodies more responsive. So if somebody comes in, when you do a lab test, you're just doing a snapshot of that moment. It's taking a snapshot of a moment in time that's what's going on in the blood, but it doesn't tell us the whole picture. So that's why when it comes right down to it, it's going to be the history that gives me a lot of information. Tick bite history, where they've lived, how it kind of came about. Were they just all of a sudden well one day and boom, they woke up the next morning and they haven't been well since? Or they remember, having something that looked like a spider bite. The doctor diagnosed it as a spider bite. Diagnosed people with a spider bite that wasn't necessarily a spider bite, and then they might notice a few months later that they, start having symptoms come up, and then the symptoms will come and go. So that can be it can throw people off track with landing on a particular disease or having a diagnosis, because they might feel really awful and then 4 or 5 weeks later be, sick again, but then have 3 or 4 weeks where they feel great. And so these microbes have cycles. So that's also what makes it difficult with labs and also right now, as it stands with the Centers for Disease Control, they do something called an ELISA test first in most of the conventional medical offices. And that, it's a screen that's supposed to be very sensitive. So initially you take a test and it screens for it. If it finds it in what's supposed to be, 80 or 90% sensitive, and it finds the infection or finds the disease, then you move on to the confirmatory test called the Western blot. And a lot of times the ELISA just does not capture chronic infections. It's much better at capturing acute, like a brand new bite, but not a chronic one. So a lot of people fall through the cracks and are told that they don't have Lyme disease because the ELISA is negative. So.
Yeah, it is such a dilemma, because many people, I think, have Lyme disease, but then they get the test and it says they don't have it. And Lyme disease is not even something that we are even really trained to treat in medical school. We learn about Lyme, but it's something you kind of have to specialize in after you graduate. So it's important to find a practitioner like you that really understands Lyme disease and all the ins and outs about it. And I know you're an expert because you also wrote a book, and your book is called Rising Above Lyme Disease. Now, what led you to write this book?
Honestly, a woman from a publishing company had heard about me through a lecture I did with an organization called the Holistic Moms Network out here in New Hampshire, and just called and wanted to schedule lunch with me and offered me the potential to write a book on Lyme because of hearing about lectures I was doing in the community. And of course, I had to go through and go through a lot more than that to write a book and to get a contract to write a book. I had always loved writing, but never had thought that I would be an author per se. But when the opportunity knocks and it comes to the door and it kind of lands in your lap, I took it, and I took the opportunity to give it a go and see if it was something I could achieve and could do. And honestly, I've been practicing for over a decade at that point. And so there was a lot to say. It was something kind of honed over the years. And I wanted it to be a book that would be helpful for the layperson, and for the individual, and not just the individual going through Lyme, but also for their family members too. Something that would help give validation or educate them about what might be going on with their body. And because it can get very confusing when all those symptoms come up. And also it's hard to explain it to others. It's hard to explain that to family and friends who might not quite understand. So I wanted something to be educational in that regard and supportive for patients. And it was also a way of being able to share what it's like to be a doctor treating this, and what it's like to live in an area that's had tick-borne infection, or that is so prevalent here, and also to be a patient. So I was sick with tick-borne disease, with Lyme disease and Babesia, and I was already specializing in Lyme at that time before I knew that I had it. So it was a very unique experience to have neurologic Lyme and Babesia. And it got to the point where I did require IV antibiotics. And it was just such an interesting situation. Again, not very much a different, I had a very different pathway as a patient than the average patient, because I'm in a medical office all day talking to other tick-borne disease patients, and being able to take my medications and then have my patients reflect back to me. Everybody's like very supportive and understanding. I knew in the community who was treating it, they were my friends, and it just, I had a much easier time once I figured out that I had it, that I had a much easier time navigating that world, to be able to know where to go to get help and how to get it done. The part of getting over it, it was a lot like what the, typical chronic Lyme disease patient goes through, where it was a marathon and it took a couple of years to recover. But it was kind of a culmination of being the patient, and also being the doctor, and then being able to communicate that in a book, and just share it and have it be available. So that's why I wrote it.
What a journey. And your book, how would you say it's different from other Lyme disease books? Like, why should they read your book?
Yeah, I have, not to sound, I'm trying to figure out how I can say this and have it sound like a compliment, because it is to everybody, it is a compliment. But I think a lot of people say that my book has been really great because it's easy to understand, easy to read. I brought in, I must have had 400 or 500 different citations, for the book itself, which ideally you would want, bringing in science and research. But I pride myself on being able to teach and word things in a way that allows people to understand it. And there are amazing books on Lyme disease that are out there, but I think that they're more written in a way where a doctor would be talking to other doctors, and with that language, it can be hard initially for someone who's new to tick-borne infections and kind of new to that world to really understand it from that perspective. And so I think that patients have told me that it was really helpful for them, very educational, but then helpful for them to be able to even get deeper into the topic and go more into the medical literature, and then have this really nice background and this platform to kind of stand on to be able to now kind of understand the language and to go even deeper and read journal articles from doctors and things like that, and kind of have the language. And so that is a compliment that I've heard many times from patients, that it really was easy for them to now kind of finally digest and understand what they were going through, and give it more of a codex or a context to put it in.
And how can people find your book? Is it available online or?
Yeah, I mean, it's it's available on Amazon, like
Right. If you're not on Amazon, forget it. You have to be on
forget
Amazon.
it. Barnes and Noble.
Yeah.
Yeah, it's a Kindle. It's also, just a straightforward paperback book. And my publisher is Fair Winds Press and Quarto. It's also available on their website as well.
So if you're thinking you have Lyme disease, go check out her book for sure, because Dr. Greenspan is really an expert in Lyme. So I know you work with other things, not just Lyme disease, and you work holistically, and you are aware of the body's energetic systems. So can you talk a bit about the different techniques you use and how people can benefit from using these additional healing modalities?
Yeah, I think that it's been, so I've done training in, just from my own personal experiences of kind of waking up to that aspect of healing and kind of expanding on medicine, energy medicine in a different way. It was starting to be dialogued about in naturopathic school and definitely was part of the conversation. But I think there's also still some reservations from delving into that, obviously, because you want to have that healthy balance of having evidence-based medicine, which I cherish, but also being open to things that we can't quite explain, but that are quite profound and powerful for patients and powerful in their healing. And it doesn't mean we need to be able to explain all of it and that we can measure it. And being open to both sides of that is really important. And for my patients, it's, I'm learning these. So let me step back. I've done training. I've done quite a bit of training in shamanic healing arts. Mm-hmm. Trained as a Reiki master, and have personally studied a lot of esoteric, philosophies and modalities, and also biomagnetic pair therapy. And something called microbioenergetics, which has to do with the emotional code and the emotional body and the energy body and its relationship with the microbe. And that's a very deep topic. But in studying these modalities, it was for me to deepen my own awareness of myself. But we have to kind of do that. We have to kind of do that work on ourselves and go there ourselves in order to be able to provide that to others. And so energy healing modalities were very important in my process of recovering from tick-borne infection. And it's something that can be it can work on a level, and again, for those that are open to doing that and where that's part of their paradigm and in their wheelhouse, and it isn't for everybody, but for those that really respond to that and want that balance in their care, it can be really, really important, especially in regards to healing on a deeper level. It really is sort of the original psychology, or psychologist or psychiatrist. It was kind of that. The healers. When we think of like the in the tribal cultures and things like that, and you'd have the healer or the shaman of the tribe. They really knew how to handle and catch illness and disease at a place where it was starting to be formed, due to trauma, or due to beliefs, or due to, typically, again, when it comes down to it, it's trauma, whatever form of trauma that might be, whether that moves through the group, the individual, the family, the collective culture, and seeing kind of catching that before it becomes something that becomes an illness, that becomes a disease in the body, or creates a weakness in the body that makes us more susceptible to illness. And so I love that I can access those tools to help teach patients how to work with that in their own lives. I do healing work in the office, but to me, the most fulfilling is having kind of dialogue with patients, or people who come and meet with me to talk more about how to expand that in their own lives, to be able to utilize that in the day-to-day, like teaching shamanic journeying, for instance, to be able to go and get their own information about their own bodies and things that would be healing and beneficial for them. Being able to teach them those ways of being able to balance and kind of work with their nervous system, just having a conversation about meditation and the different energy centers of the body and the importance of being able to stay, grounded and calm the nervous system, because the infections that I work with are very, charging to the nervous system and cause a lot of inflammation. And that can be very destabilizing for somebody energetically to go through that, and very traumatizing for somebody to go through a long-term illness, pain. If pain is a big part of their illness, being in chronic pain for a long period of time is, obviously it goes without saying, is very traumatizing. So being able to work with somebody on that level helps. I think the main thing is to try to bring empowerment back to the patient, help them feel like they're not a victim to their situation with the infection, because, when you're just beat down and sick for so long, and you don't feel like you can't make it go any faster, you can't make it change. Sometimes, it's going to go at the pace it's going to go, and your healing is going to be at what it's going to be. That, we can treat with medications. I often tell patients that, we've got the balance of both, where we're treating something from the outside in with herbs, with nutrition, with with medications, all those, the physical modalities, massage and, acupuncture and things like that. And then it's teaching people now how to work from the inside out, to be able to go inward and learn more about how they can, work with their own awareness of what's going on, with how they're reacting to their pain, how they're reacting to the illness, looking at their life and their situations and where their boundaries might not be great and where they're losing energy. And so it's about learning and teaching people and working with people to kind of learn how to bring their energy back into themselves, and so they can actually be stronger now to impact their immune cells, to calm down their nervous system, to help bring down inflammation in the body so that they can move through the disease with more ease and grace, and then get to resolution. It's just much more efficient when we're working from the outside in and the inside out. And so learning different modalities means being able to put something in a context and in a language that people can understand in order to utilize here, in the day-to-day, that can help them move through that and feel more in tune with their power, their own personal power.
Yeah, absolutely. I think that is the one way to heal, is to create that truly holistic approach that we so lack in the Western medicine today, because we tend to just work, as you said, from the outside in, with medications, and even if it's botanical or acupuncture or whatever, but it's from externally. And it's so important to do that other work to create a true healing process, to work from the inside out. So just beautiful. So you should go check out her book and her website if you would like to work with Dr. Julia Greenspan. So I know you have a website, and how do people get in contact with you?
Well, the website is greenhousemedicine.com. And then there they'll find contact information to be able to reach out to my office, or they can send an email through the website.
And do you also have a Facebook page?
I don't, but that's in the works.
Okay. It will come. So for now, just go to her website, and from there you can find how to contact Dr. Julia. So I want to thank you so much for being a guest on the podcast today and sharing all your knowledge with the listeners.
Thank you so much for having me. I appreciate it.
I hope you enjoyed listening to this episode of Dr. Lottie, Science with Soul. To stay up to date on future episodes and to help us reach a larger audience, remember to subscribe, review, and share this podcast. If you're a person who understands the interconnectedness of mind, body, and soul, and would like to take one of my courses or work with me to create a path of healing your own life, please visit divinespiritualessence.com or drlottie.com. My book, Med School After Menopause, The Journey of My Soul, an inspirational story about transformation, healing, and spirituality, is available online at Amazon as well as other online platforms worldwide.